Non-alcoholic fatty liver disease is the most common chronic liver disease in the world. It's known to be associated with obesity, type 2 diabetes and heart disease. Back with us now is Dr. Frances Pitzilis to explain what it is, what we can do to prevent and treat it. Good morning to you, Dr. Frances. Nice to see you.
Morning, Carly.
So what is fatty liver disease and how common is it?
Yes, well, there are actually two types of fatty liver disease. The one that alcoholics and heavy drinkers get, and the one that we're going to focus more on today, which is the non-alcoholic fatty liver disease. And that's the one associated with a certain group of chronic illnesses. Now, it's taking up 30% of the population in the USA, and in a recent survey in New Zealand, about 23% of New Zealanders get this problem, and it's growing.
So how do people usually discover that they have fatty liver? What would you notice about yourself?
Well, very often they don't know they've got it, and it will happen by chance. They'll have a scan of their upper abdomen for some other reason, and then they'll be told they've got this fatty liver, and they think, oh, what's a fatty liver? Or the doctor will tell them that they've got these abnormal liver tests and maybe a few other things that might be associated with inflammation or pre-diabetes, and then the doctor will want to look to see whether they've got a fatty liver. And of course, sometimes if people can find themselves becoming unwell, like getting jaundiced all of a sudden, that means they go yellow, then that could lead to the diagnosis of a fatty liver as well.
Right, so who tends to get this and what's behind it?
Well, we mentioned heavy drinkers, but it can occur as young as aged 8, and we're talking about obesity, chronic illnesses and diabetes. And the sorts of people are anything to do with inflammation. So that includes metabolic syndrome, overweight, diabetes, and people with other conditions that are involved all in that inflammation. And the whole thing gets worse with age.
So what about any underlying causes?
Yes, well, it can run in families. If you look around your family and you see this common shape of, you're getting fat around the trunk, and people tend to be heavy in your family, or people tend to get diabetes, heart disease, that sort of thing. So that's family. And then we know that low birth weight children can get this when they're older. Bad diet, too much sugar, starch and fat. Hepatitis C infection. Now, the viewers might want to know about certain medicines: amiodarone, that's used for the heart, tamoxifen, that's used after breast cancer treatment, and methotrexate, that's used for rheumatoid arthritis and autoimmune disease. Now, obviously, if you're vulnerable, you have more alcohol, that makes it worse. And then people have difficulties or deficiencies in special messengers. One of them's called leptin, the other one's called adiponectin, and these messengers are supposed to keep your liver from getting too fatty. So there are people who've got these problems.
So Dr. Frances, are there any symptoms associated with fatty liver, or I just wouldn't know that I have it apart from a bit of extra weight around here?
Often you wouldn't know, apart from maybe some abnormal tests, but people can become unwell with it. They might feel that they are tired, don't feel right, or they're just uncomfortable where their liver is in the upper right quadrant of their abdomen. Or, as one of my patients said to me, when I bend over, it feels uncomfortable. So symptoms like that, or, sometimes suddenly when you get jaundiced.
Dr. Frances, how is it diagnosed? You mentioned before that often it's something that we don't even know that's there, and it gets diagnosed as a byproduct of something else.
Well, it's suspicion, symptoms, and then you'd examine the patient, and if they had a big liver, you'd get suspicious. The blood tests, they have a scan, and then I don't know that people do this that much, but they can put you into hospital and do a liver biopsy.
So how can it be treated or, hopefully prevented?
Yes. Now, what's important about this condition is that you don't really want it to progress, because you don't want to end up with liver cirrhosis and liver failure or even liver cancer. Now, there is actually no definitive treatment for this. However, all the researchers and the people who talk about this talk about going right back to fundamentals, diet, lifestyle. There's been research about taking bile acids, like you can buy ox bile in the shops to help protect the liver. They've even looked at vitamin C, fish oil, diabetes medicines, and they've even looked at cholesterol blocking drugs and anything that blocks fat in your body, plant antioxidants, the microbiome, and probiotics. So they're still really firming up on a good pathway for it.
Okay, so what are your final take-home messages, Dr. Francis, about non-alcoholic fatty liver?
Look, my take-home messages is look around your family, keep yourself lean, keep your very good exercise, diet, get enough sleep so that you can get leptin, have a highly plant-based diet, don't gain weight, don't drink to excess. Better still, don't drink at all.
Thanks so much for your time this morning, Dr. Francis. Nice to see you. And if you are concerned about anything we've discussed this morning, please contact your own healthcare professional.